Hey everyone, I'm John Lynn, the founder and chief editor at Healthcare IT Today. We're excited to bring you another in our series of interviews with top leaders in health IT. And our guest today is Wilson Santos. He's CIO at The Clinic. Welcome, Wilson.
Thank you. Thanks for having me.
Yeah, excited for this discussion. We're here at the eClinicalWorks National Conference. Lots going on. Appreciate you stopping by. Lots to talk about with their no-show solution. But before we go there, tell us about yourself and The Clinic.
Well, I'm the Chief Information Officer for T.H.E Clinic, or To Help Everyone. We're one of the 67 federally qualified health centers in LA County.
I love that. I mean, T.H.E, to help everyone, kind of says it all about your mission, huh?
Exactly. The clinic has been there for 52 years.
Wow.
Yes.
That's amazing. I love that you're able to serve the population you do. But it sounds like, it was interesting. You decided to leverage the healow platform in your organization. Can you talk about kind of that decision to work with eClinicalWorks and the healow platform?
Sure. We're one of the early adapters of the healow no-show AI prediction.
Okay.
In fact, I think healow no-show AI is one of the first AI platform that ECW offered to its clients. Our no-shows are high. And we're looking for solutions to address the issue. So we came across on making a decision to get the platform, and yeah.
Interesting. So let's take a step back. Like, how was your experience with no-shows at your organization before using the healow no-show AI prediction model?
Well, sharing some numbers, our no-shows are around 25-28%, which is really not so good.
Yeah.
Considering that we are a local clinic, and most of our clinics are based on school-based or residential areas. So, yeah, having a 25% no-show rate is kind of like unacceptable.
Yeah, it's interesting to think about because, I mean, every clinic has no-show rates, right? Like,
exactly.
and probably more than they want.
Right.
But it sounds like maybe some of your patient population had troubles getting in or remembering to do it or whatnot. Is that kind of what you've experienced when, with why they weren't showing up for their appointments?
A little bit of everything. So, like I said, we're primarily residential school-based areas, so people are busy, they forgot to show up, and they may know that they have an appointment, but they got better, so they just decide to not show up.
Yeah, that makes sense. So talk to us, like, how does the healow no-show prediction model work, and how has it kind of changed that experience for your patients?
We're one of the early adapters of healow no-show AI prediction, so we're kind of like, you can call it a guinea pig.
Yeah, we appreciate that. Someone has to be, right?
Well, yeah, we're at that point, we're desperately willing to try all ways to improve our no-show, so or get it better at least, right? So we tried it. It wasn't easy. During our first year, there was a lot of bump in the roads to smooth it out. But as soon as we jump into V12, that's when everything gets a little bit more smoother and automated. That's when we started to see the fruits of our labor.
Interesting. So tell us more about, what goes on with, especially on the newest version. So it goes in and analyzes your patients to understand who could potentially be a no-show. And then are you doing outreach to them to, remind them, or, how are you approaching using the data that they're offering you?
We use the data coming from the predictive analytics to gauge or to get the patient that are, so to speak, frequent flyers.
Okay.
We've set the benchmark of 85% of the patients that are not showing most of the time. And from there, that's what we worked on. We offer mainly what we've found effective on the solution is we have assigned front desk people who reach out. Like you said, we the way of us outreaching is, and we can find the reason why they most of the time not show up on their visits.
Interesting.
We offer either transportation, since we have a transportation service, or we can
That's
call
awesome.
them an Uber.
Uh-huh.
Or we offer telehealth services. Sometimes they just, doesn't wanted to drive down to the clinic because they're so busy. They're
Sure.
taking care of their children. So either or, but those two things has been our 1-2 punch in attacking the no-show. So
Interesting.
earlier I told you about our no-show rate being 25 to 28%. After about a year or so of using it, we are currently at 13 to 14% no-show.
Wow.
So tremendous result. The leadership is happy. People are happy, that they're able to make their appointments, and the continuity of care is there. So, yeah.
Interesting. Tell me more about that. Like, I love that impact. The fact that you've moved it to 13%. That's a dramatic change. Did you end up freeing up appointments to be able to have other visits, or is it more that people are getting care that they wouldn't have got otherwise because they would have missed the appointment because they didn't remember, they didn't have transportation, or they decided to go telehealth? Like, did it open up more space for other appointments, or do you think it was more about making sure that those patients got the care that they needed, which is probably really important as an FQHC, since you have responsibility for the care of that whole population?
Both of them, basically.
Okay.
We were able to free up a lot of appointments since patients are now starting to show up. So we're able to free up more future appointments for
That's
other
true.
potential patients. And at the same time, the process has become more streamlined for the front office.
Interesting. Are there other ways that you're leveraging healow to kind of improve the patient experience for your organization outside of just the no-show, or are you using any of the other scheduling or communication capabilities in healow?
At the moment, we might consider some new products. We're definitely looking forward for Genie. The keynote from yesterday is really an eye-opener and inspiring, coming from the CEO himself, Girish. And I think my leadership has realized the potential of usage of AI. So we're definitely more than willing to try other AI products in ECW.
That's awesome. Tell me, what has been your reaction to the keynote? He announced a whole swath of features, AI solutions, even the ambient, computer in the room displaying information. What's your reaction to a lot of the announcements that he made on stage?
The potential is limitless. ECW has been continuing to improve and continue to work on. It can only start from here.
Interesting. So what's next for you when it comes to patient engagement and in your organization leveraging technology? Are there any initiatives that you're excited about, or things you're working on that whether it's eClinicalWorks or otherwise, anything that you see next for your patient population?
Just continue to leverage on technology, have everyone, all of our staff members understand and embrace technology, and just continue to strive for the best.
That's awesome. Wilson, I appreciate you taking time to come and chat with us and share your experience with the no-show. Congrats to you and the team on so much improvement, that benefits your patients, benefits your organization, benefits the other patients
Exactly.
that now can get appointments. I appreciate you taking time to talk with us. And thanks everyone for watching and listening. If you want to find more great healthcare IT content like this, be sure to check it out at healthcareittoday.com or search for Healthcare IT Today on your favorite podcasting applications. Thanks, Wilson.
Thanks for having me.